All right, good afternoon or good morning, depending on where you're joining us from. And I would like to welcome you and thank you for joining us today on a discussion of our general surgery residency programs at the Harvard affiliated institutions. Today's webinar is sponsored by the HMS Office for Diversity, Inclusion, and Community Partnership. And our mission in the DICP is to advance diversity and inclusion in health, biomedical, behavior, and STEM fields in ways that build individual and institutional capacity to achieve excellence, foster innovation, and to ensure equity in health locally, nationally, and globally. DICP efforts support the career development of junior faculty, trainees, and students, identify and train leaders in academic medicine and health policy, and provide programs to address crucial pipeline issues. A little bit about the VCP webinar series. Today's program is the fourth webinar in the 2021 Visiting Clerkship Program webinar series. For 30 years, the VCP has been a model of excellence, offering outstanding medical students, particularly those from underrepresented groups in medicine, an opportunity to participate in externships at Harvard Medical School and its affiliated hospitals. Since its inception of the program, 1,583 students have rotated through the VCP. Obviously, we're still dealing with the ramifications of the COVID-19 pandemic, and we recognize there's a lot of uncertainty that comes about with the application cycle for residency. With this in mind, we're hosting these webinars in order to bring the members of the HMS residency programs and medical students together to share ideas, provide support, and address questions on transitioning to the next stage of your medical training. These webinars provide an opportunity to discuss the application process, address questions from students regarding away rotations, and as well any other concerns that you may have. Just a few housekeeping notes. Chat is not available. Microphones are muted. If you do have a question for our participants, please use the Q&A to post questions, and I'll be reviewing those questions and bringing those into our discussion. And this webinar is recorded and will be posted on the DICP website, which you can go back to and reference if you need to. Quick introduction of myself. I am Alden Landry. I'm the Assistant Professor in Emergency Medicine, the Assistant Dean for the Office for Diversity, Inclusion, and Community Partnership. And I'm going to be moderating this discussion. Next slide. We are joined by three amazing individuals who have given up an hour of their busy schedules to join us for this discussion. We have Dr. John Mullen, who is an Associate Professor of Surgery and General Surgery Residency Program Director at Massachusetts General Hospital. We have Dr. Chaz Parsons, who is an instructor of surgery and the General Surgery Associate Program Director at Beth Israel Deaconess Medical Center. And we have Dr. Stephanie Nitzschke, who is an Assistant Professor of Surgery and the General Surgery Residency Program Director at Brigham and Women's Hospital. And what we're going to do over the course of the next few minutes is allow each program director to share a little bit about their program, what makes it unique, and why their program is amazing and why you should consider applying for their residency program. Next slide. So first we are going to turn to Dr. Parsons, and you can chat with us about Beth Israel Deaconess Medical Center and what makes your residency program special.
I think I prepared a slide, but in short, Beth Israel's in a unique place. We're in Longwood. We have 9 residents a year. I think we offer exceptional clinical training. We have all the services of a major academic medical center, huge emphasis on research during our program and lots of opportunities for both research and innovation. We have wide range of opportunities if you want to get involved in departmental initiatives or other aspects of sort of the environment here in Longwood. Collaboration with other hospitals, with other fields is a priority for us. We place residents into all sorts of fellowships, you name it. Some of our residents have gone there, whether it's surgical oncology, cardiothoracic, critical care, MIS. We have all those here, and we also send residents away, pediatric surgery, etc. I apologize, Dr. Kent couldn't make this. She's our program director and our leader of our residency program. I'm one of the associate program directors, and I'm happy to take any questions as well. Our contact information is listed below there, so please reach out if you have any questions at all. I'm happy to answer them. So thank you.
Thank you, Dr. Parsons. Next is going to be Dr. John Mullen at MGH.
Thanks, Dr. Landry, and thanks for the invitation to join this webinar. I think I have a slide there too, Jasmine, if you want to. Perfect. So, you know, they asked us just to make one slide and try to capture the spirit of the program. And I think I tried to do that here with this collage of pictures. I think one of the nice things about our hospital is it's a very historic place. We're the oldest hospital in New England and the third oldest hospital in the US. It was the site of the first demonstration of ether anesthesia back in 1846. There you see the ether dome, which is on the 4th floor of our Bullfinch building, which isn't a patient care building anymore, but houses most of our administrative staff. Obviously, the hospital has evolved now to a state-of-the-art facility. It's the largest hospital in New England with over 1,000 beds. We have state-of-the-art operating rooms, and really we're strong in almost every discipline, whether it's surgery, medicine, obstetrics, psychiatry, etc. We take care of patients in the full lifespan, so it's a true general hospital. We take care of kids and have our own children's hospital embedded in the hospital, and in fact have our own pediatric surgery division. We have a robust operative volume, doing over 24,000 cases per year, and that includes sort of the very simple inguinal hernias and gallbladders all the way to the more esoteric procedures such as, you know, resecting IVC leiomyosarcomas and the like. We're loaded with tremendous leaders in almost every field. I just put a snapshot there of a picture of our 4 most recent chairs, all of whom come to campus, some less frequently than others, of course, with Dr. Lillimo, our current chair, flanked by Dr. Austin, Dr. Warshaw, and Dr. Russell. There's tremendous flexibility in our program. Some residents go straight through, particularly if they already have a PhD, while others will take time off to do research. We have a number of tracks into various specialties. A particularly popular one is our 4-3 cardiothoracic surgery track, in which residents will do a large volume of cardiothoracic surgery at a fellow level in their 4th and 5th years. Others can track into other specialties though, like transplant, vascular, and the like, if they want advanced training before they get to fellowship. And then we also have a global surgery track for those so inclined. We're very blessed with lots of grant dollars, so you really can do research in almost any field. We topped $1 billion in research funding as a department in fiscal year 19, which is quite a tremendous accomplishment, and we're the highest funded surgery department in the United States. About 90% of our residents end up taking time off to do research, and it's a nice break, you know, from the residency. We've made a big push on wellness. It's long overdue. There's a Peloton bike in virtually every call room now, and we're making a real effort to try to make training in general surgery less stressful. Hopefully some of these initiatives are keeping our residents happier and healthier as they train over the course of 5 years. We've also made a tremendous push to diversify our residency. 40% of our incoming intern class are underrepresented in medicine, and so we're very excited to receive your applications. We're a top ranked program. Doximity's been ranking residencies for the past 4 or 5 years, and we've been at the top of that list, and I'm very proud of that. And lastly, our residents tend to end up in very good fellowships. We've had great matches in almost every specialty. And that's important when you identify a residency program, because obviously most of you are probably going to go on to do a fellowship. And so having that preparation for the next step is important. There's my email if you want to reach out with any questions. And you can also check out our website. There's lots of information about the program as well there. Thank you.
Thank you, Dr. Mullen. And last, but certainly not least, is Dr. Nitzschke, who will tell us about the program at Brigham and Women's Hospital.
Well, thank you for having me today. I am excited to share about our surgery residency program. We have also 9 residents a year and graduate 9 chief residents. We have, more interns and second years, and there's some flex around our residents as they go in and out of research. So sometimes we have a little more and sometimes we have a little less in the middle. I think, when I think about our program and, what are the highlights, one is that we see this wide breadth of clinical surgical pathology where the residents are exposed to many different things, some simple and some immensely complicated. And that really gives them a huge technical and medical fund of knowledge skill set when they graduate this program. We're lucky to go to some of the most amazing institutions in the world for training, to include the Brigham, but also they do pediatric surgery at Children's. They have the privilege of rotating at the VA hospital and taking care of those patients. We are partnered with Faulkner Hospital, which is just down the street, which really is high volume, bread and butter general surgery. And then we go to another hospital called South Shore Hospital, which again is, a lot of wonderful operative opportunities. The other piece that I think is really valuable about our program is that the faculty are so engaged in mentorship. They really love growing our residents and helping them find, that piece about them that they want to mature as they become these skilled academic surgeons. And that's a huge part of who we are and what we do for our residents here. It's really fun to talk to them and figure out what they want to do with their lives and then watch them grow as they mature into these, sort of individuals who have this passion, not just for surgery, but some sort of research or academic development, and they do really interesting things. And I feel lucky to be at a hospital like this where we really can support them in almost anything they can think of when they choose to go out for research. So there's a lot of opportunity around that. And then I think the third piece is, we have these wonderful residents. They create this amazing community. They're really a team. They like to spend time together. And they take, amazing care of our patients. And so they do such a good job. And I think they make each other's lives better because they learn and grow together, and we have a wonderful supportive community around that. I think also we have a really robust global health program. I have 3 of the global health surgeons are in my department. I'm one of the trauma surgeons, and we've mentored a lot of residents in that realm, and I think that's been a wonderful piece, and that has grown exponentially through here. We also have the Center of Surgery and Public Health, which is a wonderful space for resident growth, especially for research, but they've done a lot of the groundbreaking research around disparities in healthcare, and so that also is a really wonderful opportunity for our residents. We have faculty mentorship around our wellness program as well, and we do a lot of, kind of cross residency work with the MGH residents as well. And they started this MGB Ideal program. So we're a little more collaborative with our residency programs, which has been really nice to see that grow over time as well. And so you're welcome to follow us at our Brigham Surgery Residents Instagram and get a little more information about what we do. I'd love for you to take a look at our website as well. And I'm happy to take any questions via email or otherwise. But thank you for the time.
Awesome. Thank you to all 3 of you for giving us an introduction to your program. And I think it's time for us to just jump right into the questions and really try and answer some of the concerns, address some of the concerns that the students may be having as they're about to enter into this application season. So I want to go to you first, Chaz. Can you give us an overview of the timeline for this year's ERAS application season? And how are you preparing for the application season, given that this is different than years prior?
Thank you, Alden. You know, it's a little bit up in the air right now because of the pandemic, and it's a changing sort of landscape right now. However, I would emphasize to all the applicants that ERAS opens, I believe, tomorrow on June 9th. So you can start getting your application ready. The applications are due on September 1st to submit. That's the earliest time you could submit. And my general advice is to start getting it in early is always better than getting it in late. As is September 29th is when the programs are going to start reviewing your application. That's the earliest opportunity. And the main thing I would emphasize is that, you know, it's going to be a changing landscape right now. We haven't committed yet to being in person or remote, but I think that's going to be an issue going forward. I would just emphasize that for anyone who's interested in applying, now is the time to start looking at programs, getting your application ready, and start looking for letters and that sort of thing, because it comes quickly after this summer.
Yeah. Whether we're virtual or in person, this is going to be a very quick process, and students often get really caught up in sort of the anxiety-provoking aspects of this, but time moves really quickly. So regardless, make sure you're paying attention to those deadlines. Stephanie, given the uncertainty about the application season, what are you recommending for students to do about the application process as they come to you looking for advice?
So I think one of the best things to do is get all the information you can and think about what exactly you're looking for from a program. Are you looking for research opportunities? Are you really trying to be basic scientist, global health, these types of things? You should meet with as many people as you can who know the programs that you're interested in or know programs that would be interesting to you, and then really try to dive into those programs, talk to as many people, look at their websites, read everything you can about them, reach out to people that you know, and really just try to find out as much information as you can so you can get a sense of what they do for their residents, what the culture is like at the hospital, those types of things. I think talking to as many people and then making sure you have a good mentor. I think having a mentor who can guide you through the application process is really helpful, and definitely, help you when you're, deciding about programs to apply to, writing your personal statement, those types of things.
Wonderful. I think we can't underestimate the importance of good mentorship in time like this. Those individuals can really help you get insight to not only yourself as a potential trainee, but also they may have connections who can give you a little bit more insider information about what a program may have to offer or how they may fit with your personal and professional aspirations. So I think that's a really good point to lean in on. John, one of the things that we're known for with the visiting clerkship program is bringing students to our campus and allowing them to do away rotations. And a number of students are trying to do so, but it's a relatively narrow window for students to do so this year. Here at HMS, we're not offering rotations until August, and that window is going to close probably around November. How will away rotations be viewed this application season if a student is able to do one?
Thanks, Alden. Yes, we've taken advantage of some students who've come by way of your program, and it's been a real pleasure to host them here for the month. And I recognize that given the pandemic, not everybody's going to be able to come and do an away rotation. In fact, nobody did last year. We only were able to have the Harvard students. And so I guess I would reassure those who are unlikely to be able to come that it won't dramatically influence your chances of matching here. We matched 10 categorical interns this year, and only one was a Harvard student. 9 of them we'd not met previously. They hadn't done a sub-internship here, and they were just great candidates. And so that's the first point, that you don't have to feel compelled to visit. Now, admittedly, if you can, that would be great. We'd love to have you here for a month, and feel free to reach out too if you're having any trouble navigating the system. But again, certainly you don't have to feel pressure to necessarily visit one or even any of our programs if you can't, because we'll still take a careful look at your application, and I think you still stand a very good chance of matching because every other kid is in the same boat as you. So try to be flexible, try not to stress too much. This year will hopefully be a little better than last year, and maybe we'll have in-person interviews, we don't know. which would obviously give you a chance to see the campus. But even not, we have virtual video tours, etc. So anyway, I don't know if the others have anything to add, but I think that's my take on it.
Well, and I was going to turn to you, Chaz. Similar question. Some students are going to get rotations, others aren't. For those students who aren't able to get away rotation, is there anything that they can do to learn more about the program? And will their applications be looked at any differently? It sounds like Dr. Mullen saying no. I'm sure that's probably the same case for the BI program as well.
Yeah, I completely agree with Dr. Mullen. It's nice if you can come and visit. It's not a deal breaker though. And a lot of our residents who matched did not do rotations with us. I think it's important to realize that a visiting rotation is a great way to meet the personalities and get a sense of the culture. And you work hard and hopefully you meet some good mentors or at least make some relationships, but it can also be the opposite. You may find that this isn't the place for you, and you've wasted a month. So it's a mixed bag. We like to have students come visit. We love having them. It's a great opportunity, but understand that it's not necessarily going to impact your application. We look at everyone very closely in all respects. So if you don't get your ideal rotation, it's not the end of the world. And there's other things you can do to sort of impress or at least show interest in a program. And that's looking at the website, calling friends, calling people who you may at your medical school or other relationships that you may have and say, hey, kick the tires a little bit of that program and see what the culture is. So I wouldn't, a visiting rotation is not necessarily the most important aspect of your application. So I would just emphasize that.
Awesome. And just a quick question, are any of your hospitals, your residency programs offering virtual clerkships this year? Is that something that you all are considering? Chaz?
Yeah, I'll put a plug in. We did our first virtual clerkships last year and it was a huge success. I think 2 of our residents who matched did the virtual clerkship, which was a really great opportunity for us to keep, during the pandemic, keep interest and show some of our teaching aspects with our faculty. It was very, very well received. I think we're going to be doing it again this fall. So keep an eye for that.
John or Stephanie, are you all offering virtual clerkships this season?
We did it last year. I don't know if we're intending to do it this year.
Yeah, we didn't last year either. We did have some webinars that were run by faculty and residents to try to give some insight into the culture and the pros and cons of the program, et cetera. And we plan to do those again at some point in the late summer, early fall.
I think we're still engaging in this virtual space and trying to figure out what works best for our programs and what works best for us to reach out to the students. And we're all kicking the tires to see what's going to be the best option for us as we move forward. Stephanie, if a student has a particular interest in a program, I think we've started having this conversation already about mentors and websites and looking at social media. But how can a student go about letting a program know that they're genuinely interested in that residency?
Yeah, I think they should be encouraged to reach out to the program director or anybody in the surgery leadership. Maybe they have a relationship with a faculty member and they communicate that way. But I really enjoy hearing from people who are interested in our program and want to learn more about it, or even just the process of applying to residency. And I meet with students outside of the Harvard medical system all the time, and I'm really happy to do that. And I would say that I'm certain the others are as well. It's really important to us to meet students that we think we can, mentor and grow and are going to fit in. And so the more students we have the opportunity to meet, I think the better we're all going to do at that, creating that optimal match for the student and the program. And so don't be shy, reach out. We want to talk to you, hear from you, learn about you. And so, and we're happy to help for people who, even if they don't want to come to the Brigham, I don't mind. That's part of my job, is to help mentor students into becoming the surgeons they want to become. So I think just feel very confident and comfortable reaching out to a program that you're interested in, and they'll be very receptive.
Awesome, thank you. And John, is there value in reaching out to current residents in the program to learn more about the program, or what about some junior faculty? Is that something that you would recommend?
Yeah, I would absolutely recommend that. I mean, frankly, the residents are probably the most important people to talk to. They're in the thick of it. They just went through the process, especially the current interns. And so they can really give you a great feel for the program and what it's like to train here. And that's why when we initially did some webinars over the summer, they were kind of combined faculty and residents. And then the residents said, you know, Dr. Mullen, we want to do some really informal ones on our own, no faculty around, and let the students really ask us questions uninhibited. And so they did several of those after our first few webinars in the fall, and I think those were a big hit. So anyway, we'll do those again this fall, but anyway, you can gain access to the residents, and on our website, there'll be contact information for them. I think it's a great idea. It's a nice way and a very comfortable, informal way to learn more about the program. Junior faculty, same thing, more approachable perhaps than emailing me or Dr. Lilimo or someone like that. I'm always happy to hear from you, of course, but sometimes it's nice to ask someone who's more junior, or you may have an interest in a certain field and want to ask somebody a question germane to their specialty. So don't hesitate to reach out.
And what I generally say in these situations is we're a pretty welcoming faculty across the board. And I think that if you have a genuine interest in our program, the best thing that you can do is start to ask questions. The more information that you can have about our programs early on will make you more comfortable with adding us to that ERAS list of programs that you're going to apply to, and then ultimately to the places that you accept interviews to and then rank highly. So get as much information as possible and try and use the sources that you can verify, and really discourage people from going on some of those websites and forums that may have some misinformation that's out there. So come to us and get the actual information. We'll be honest with you and tell you what it's really like in our programs. Chaz, I want to go to you and talk about the application itself. A lot of students are, we were all impacted by COVID. Some students had rotations that were altered, and therefore they may have had a weak clerkship evaluation, or they didn't perform well for one reason or another, or they had a lower step 1 score. How can students set up their application to overcome something that they may see as a negative?
It's a great question. I think we've all realized that things changed last year, and we have to be flexible around that. For a step 1 score, there's multiple ways to, one, explain what was going on in your application, to show that maybe your step 2 score is higher, and that can show that you can make up for that, so to speak. I don't think any of the programs, at least we don't have a cutoff for step 1 scores or other aspects of your application. We try and look at holistically at the applicant, at all their pluses and minuses. And if you have one bad rotation, we've all had that, and shouldn't doom your surgical career. So maybe you had other really good rotations. I would get letter writers or other aspects of your application to speak to that. So I would not be discouraged by a bad step score. It means that you may have to emphasize your research or some other aspect of your application, but I would doubt any of the programs will just take one bad mark and apply that to your entire career in medical school.
Yeah, 100% agree. And Stephanie, what should a student do if they haven't taken step 1 prior to applying? Should that impact their decision to apply to our residency programs?
So I think, that's a tricky question to say right now, right? Because this is the last year, I think, that we'll have the step 1 score. And so I would say this year, if you're pleased with your step 1 score, you could leave it as is and take the step 2 when it makes sense for you. If you are unhappy with your step 1 score and want to bolster your application with the step 2 score, I think that's reasonable to do as well. I think because programs know the step 1 is going away, the step 2, if it's still scored and not going to be pass fail, then may pop into applications as slightly more important, but probably moot for this year. But as Chaz was saying, I think most programs have really gone away from looking at these only specific objective data, and they're looking a lot more at the letters. They hold more relevance. They want to see what you're doing with your time, your leadership skills. You know, your performance on rotation is part of it, but certainly not all of it. And so they really want to know, you know, sort of all the pieces that make up the applicant, because you know, some of these more objective pieces are going away. And so I think by and large, you know, it's the whole package that makes the greater picture, and instead of just one piece of it. So.
Yeah. And we're really trying to embrace holistic review in these situations so you get a better understanding of you, because, you know, well, I often tell the medical students that I advise, one exam, one rotation does not define who you are as a doctor and what you're capable of. And there's so many other components to you that can help turn you into a great physician or a great surgeon. So make sure that you bring that to the table and not just be solely focused on one particular score of an exam. John, any thoughts on what students should be thinking about as they start to craft that personal statement? I know Chaz mentioned earlier that ERAS is going to be opening up soon, and a big component of that is that personal statement. And just as a side to that, with COVID being such a universal topic, should that be something that students talk about as part of their application?
Yeah, that's a great question. I think that I see the personal statement as a chance for you to share something about yourself that you can't really present anywhere else in your ERAS application, and maybe even your letter writers won't say much about. And so that's a chance for you to talk about, you know, the challenges maybe you've overcome. Maybe you had to work 2 jobs to put yourself through college, or maybe, you know, the reason your step 1 score is a little low is because there was a death in the family, or something that, you know, the reader of your application wouldn't be able to learn in some other way. The other thing that I find helpful in your personal statement is sort of let us know who you are. What makes you tick? What are you passionate about? There's no right answer, right? So one person may want to be a surgical educator and is really passionate about teaching. The next person may want to do global surgery. The next person may want to do disparities work. The next person may want to do hardcore basic science research. So those are all great things, but I kind of want to learn, like, what is it that you want to do with your life? And so providing a little bit of information, if you know, about kind of what you see your career, or how you see your career unfolding, I think is helpful. In terms of COVID-19, obviously we've all been impacted in some way by it. And so I guess I would focus on it only to say if you did something special as a result of it. You know, maybe you delivered meals to people who are homebound, or, you know, maybe you spent a significant amount of time, you know, in a unique way taking care of COVID patients or something. But I think anything to say, well, it really disrupted my clerkships, and, you know, well, it disrupted everybody's clerkship. So I think you maybe just focus on how it may have impacted you or how you responded to it, you know, in a particularly unique way.
Great, thank you. And I think the emphasis on the personal statement is recognizing those 2 words: make it personal and make it a statement about yourself. It's a way for you to give that piece of information that Dr. Mullen was just talking about, that really makes you stand out and talks about you as the individual, and not necessarily just lumping you in with a group of applicants that makes you sort of indiscernible as we try and tease through these applications and really get to know who you are. Chaz, I'm going to talk about letters of recommendation now. What should students be looking for in a letter writer, and what can they do to help that person who they do select to write a letter write the best letter of recommendation for them?
You know what, when I tell medical students, I think the important thing is that the person who's writing the letter actually knows you, and can speak to some personal, you know, something about you. If you just spent a week with them in the ICU, for instance, it's really hard for the letter writer to give a good, you know, say something unique about you other than they showed up and did a good job on this short rotation. So I would emphasize looking for people who you have a real relationship with, or at least a mentorship relationship, whether you've done research with them, something like that, just to make it a little bit more personal. I think we've all read a lot of impersonal form letters. That being said, I think it's important, or at least you should try and get your department chair, if you can, to write a letter. A lot of places require that. I think that puts somebody with a known name on the record about you and your application. And then the third thing is, it's a constant debate. Often you'll know maybe junior faculty better and then senior faculty not as well. There is something to be said for the more well-known the person is, their letter may carry a little bit more weight. That being said, if they're very well known, but they don't know you, then I don't think there's a lot of value in that. So it's a hard sort of thing to manage. The one thing I would emphasize to the student is make it easy for your letter writer. Please provide a resume, a cover letter, or at least some introduction, and try and make it as easy as possible for the letter writer to write a good letter for you. So don't badger them, give them plenty of lead time as well as plenty of sort of warnings when, hey, my application, I'm going to submit it next week. Thank you again so much. Kill them with kindness, do all the things that will set you up for success for having good letters.
And that's an interesting discussion because we often have conversations with students about whether it's best to have the most senior person write the letter or someone who's junior and knows you well write the letter. And I think it's really about how well that person can represent you in those letters. And so you have to think about that. And the great thing about ERAS is you have the opportunity for 4 letters. So you can get some variety in those letters and those from those experiences. Just a quick question. Would you recommend that all the letters be from surgery, or would you recommend that they come from other specialties? And I'll just stick with you, Jess.
I definitely, we prefer surgery letters. I don't think that it has to be, especially if you did research in a basic science lab and you want to somebody to speak to that experience. I think that's fine. But generally, if you have all letters, or at least the majority of your letters are from other specialties, then I think that raises some questions among people reviewing the application, like how come you don't have some surgeons writing letters for you? So I don't think there's an absolute answer to that, but my bias would be to have more surgeons, just because it's the field that you're going to be entering, and it's more likely that we know those writers or at least understand them.
That makes sense. That makes sense. And there was a question that popped into the Q&A about a poor performance because of one reason or another. And one of the things that you can do is, if you don't want to use that space in your personal statement to talk about a poor performance or a struggle or something along those lines, is you can use your letter writer to help you with that, especially you have a good relationship with that letter writer, and that individual can put in some comments about, despite this setback that this individual may have had during their medical school, whether it's a weak performance on a rotation or not the most stellar step 1 score, they can attest to what your potential is in the specialty. And so take advantage of those strong relationships that you have and try and identify letter writers who may be able to help you bolster up some of those weaknesses that you perceive in your application. Stephanie, I want to go to you because this is a question that I think we were all concerned about last year. It sort of played out in a way that we expected it to, which is students applied to a lot of programs, maybe more so than they should have, definitely more so than they should have. As you are encouraging students to sort of pare down their list of programs they're going to apply to, how should students think about the right number of programs to apply to?
Yeah, so I think this is definitely one of those spaces where having a good mentor can really help you with this, because a lot of it depends on where you want to go and how competitive you are as an applicant, and that might up the number that of places you need to apply. And I'd say that on average, you could be anywhere from 15 to 20 interviews. I think many people did much more than that this year. I know our application pool went up by like 400, I think. And so I love that people were, maybe thinking about places that they, had never thought about before and applied widely. And I think that's wonderful. But now that we may be going to in-person, that doing that might not be possible for many people. So you have to really sort of weigh the risks and benefits of applying to some of the places, if you think about how competitive you would be at some places versus another. But the benefit of applying to a lot of places is you get to see them, and maybe some places better than you imagined, or you got more information about a place that you thought you would love, but you don't. And so I think the more places that you can see is really helpful when you're going to spend, 5+ years at any one program. It's really nice to know that you really sort of adjudicated that you spent some time, finding the best match for yourself. So I do think if you're if you've talked to your mentor, sort of get a sense of how competitive you are and how competitive you are for certain programs that you're interested in, that will help you sort of determine the number. But, you know, I think 15 to 20 is 20 being excessive, I think, but, you know, 15 programs is probably around average.
And the AAMC has some really interesting tools that you can look into, and you can base it off of, I think primarily base it off of your step scores. We're going to have to figure out some new modeling for future years, but it sort of gives an analysis of sort of number of programs you need to apply to in order to successfully match, and breaks it down into different categories. But I'm sure there's that information is available for all the students, so take advantage of that. But just to double down, talk to your mentors. Your mentors can really help guide you through this process, and that's a really important aspect of this. John, going back to the discussion around interviews and whether virtual versus in person, OB residency programs, they've already committed to a virtual interview season this year. Do you think that surgery is going to do the same?
Hard to know. We certainly don't know yet. I mean, if I had to bet, probably yes. You know, I think there's real practical advantages to it. Saves you a ton of money, a ton of time. Although we always do a post-match survey of our interviewees, and we usually get a pretty good response rate. And 90% of the applicants wanted in person if they were given a choice, you know, last year. And so I understand it. You know, people want to see the campus. They want to get a feel for the human element that is hard to capture by Zoom. But that being said, there are real advantages, again, to the virtual platform. You can interview at more programs. You can interview even in 2 different time zones, you know, 2 programs in one day. I think I was more impressed with how it went this year, and I got a really good feel for the applicants. And so I wouldn't stress if it ends up being virtual. I do feel like my sense anyway is that it would have turned out the same way if I interviewed people in person. I'm not so sure that it you know, it's a huge loss. I think the programs are probably happier with the virtual than the applicants. But anyway, I don't know. It's a short answer. But either way, I think it'll all work out.
You know, and just to say, we're all sort of going through this process together, and we're dealing with different states having different regulations and expectations and travel restrictions in the hospitals, because you're going into those hospitals and what their expectations are. And so just understand that we're adjusting accordingly, and we will do our best to keep you informed as we go. But please understand that it's important for you all to be flexible as well. Chaz, given that we're probably going to be doing some of this virtually, how do you advise students to shine during a virtual interview? Any recommendations on how to do well?
The same recommendations with any interview. I mean, smile, show your personality without, you know, be professional, dress appropriately, try and minimize the distractions for the interviewer. I know your roommate has a cat, but it's probably not the best time to have the cat in the, you know, jump up on the interview screen. You know, I think it's really, the goal is just to get across the best version of you during that short window that you have. If you can show some personality, and, you know, I find that in Zoom, where it's hard to really, you know, make that connection with your body language and other aspects. So whatever you can do to take advantage of that, with better lighting, make sure your sound works, make it easy on the interviewer to sort of get a sense of who you are in a professional way, would be my recommendation.
And Stephanie, it seems like I'm asking you all the questions about numbers. And so this is something that sometimes comes down to, you know, it's definitely a number. It's because it's their rank list, right? So what should students think about when they are ranking their programs 1 through 15, if they interview at all 15 of those residency programs you recommended they look at applying to?
Yeah, so you know, obviously this is, you know, gets very personal, because they may have geographic restrictions or, you know, constraints that are more than just, you know, how good the training program is. And so you need to take all of those things into consideration. And I think, you know, first things first, you should never put a program on your rank list if you don't want to go there. And then I think, you should put down the programs, in ways that, when you go through your interview, you get a sense, virtual or not, you do get a sense of where you might fit in. And then you're going to weigh that with the opportunities that program is going to give you, right? So many of the programs that, especially all the ones on this call, you're going to get amazing clinical training, you're going to have research opportunities, but there's going to be nuances about each one that will make that program, more or less the right fit for you. And so I think putting them in that order makes a difference. And then again, talking to your mentor and thinking about, what is, sort of realistic for you in terms of your competitiveness, about where you should be ranking, putting all the programs on there that you would be happy going to. I think you should definitely do that as well. Because at the end of the day, you want to have a program to go to. And I think everybody wants, the mentees to match and the applicants to match.
And we're going to switch topics a little bit and just talk about Boston, talk about wellness, talk about culture, talk about climate, because I think a lot of applicants are thinking about these things on their applications as well. And so for you, John, and you mentioned this earlier in your slide with the Peloton bikes in the call room, but as we discuss physician wellness, what is your program doing to address burnout and support your trainees better as we deal with these issues?
Yeah, I mean, this has become a hot topic, obviously, in medicine at large, certainly at the residency level. I'm sure all three of us have wellness committees, and they've all come up with really, I think, some fantastic ideas that we've been able to implement. Peloton bikes are great, and it's nice for people to be able to exercise when they're on call and so forth, but there's a lot more that we're trying to do. Obviously, we're trying to fix those services that are just too many hours, right? In general, most of our services are compliant, but there's services that aren't. So trying to add extra manpower to those services so people can get out on time. One thing we've been able to do this year, which we're really proud of, is we were able to hire a psychologist who's just for the Department of Surgery residents. And this psychologist meets with each class. We pull one class out of didactics each Thursday to meet with this individual. He's been practicing for 40 years. He's retired from his practice, but now is focusing just on initiatives like this. And he gets to know the residents. He's been doing it now for more than a year. And it gives the residents a safe space to just sort of debrief, talk about the challenges of COVID, talk about the challenges of being a married surgery resident, or maybe they had a bad outcome and the patient died the other day. And it gives them an opportunity, I think, to just sort of show their emotions and let sort of their guard down a little bit. Because in surgery, so much is about bravado and being tough and just, kind of pushing through and not ever really reflecting on what it's like. And so we've been really fortunate to be able to have this individual, and we look forward to hopefully having him with us for a few more years to continue to serve as a sounding board for our residents. And I know they've really appreciated that. We've also done a number of other things where the team building stuff's been tough because of COVID, but we're starting to get back into buying Red Sox tickets and planning some events now that things are opening up. Because that's a big part of kind of what we did pre-COVID. So anyway, I'll let the others share maybe what they're doing too, if they'd like.
Awesome. Thank you for that. Jazz, can you talk about the culture of Boston and how some of your trainees who are underrepresented in medicine have reported their experiences being here in Boston? And I just want to give the caveat, we have, Boston has a reputation of being a city that has not been welcoming for minorities. And what I'll say is, for me as, a Black man from the South, moving to Boston was an experience, but it was not what I saw and heard. It was a different experience when I got here. And I haven't had the negative experiences as others, but some of our folks that have come here have had negative experience, but others have had really positive experiences. And so, Chaz, any thoughts anything that you've heard from your trainees?
In general, our trainees are very happy with Boston. I think, it is an academic town. There are students from all over the world on any given day in Boston. And I think that's really our strength, is the diversity of experience, the diversity of, you know, people that are in this town. I agree, it's a very complicated history, and there are some bad experiences, but I think those are definitely outweighed by the good experiences. It's a very cosmopolitan city. There's opportunities to find your niche or your group all over the city. I don't think that is represented as much in public opinion or in popular culture. It's not a completely Irish Catholic town necessarily. It is quite diverse. And that goes from our patients to our staff to our residents. So we really, I think there's an opportunity, and my experience, or what I've heard from my residents, is that they've all had a relatively good experience coming to Boston and meeting. Basically, you know, it's just, we have MIT, Harvard, all these other students that are around from all over the world. So I think we can really play into that.
Gotcha, thank you. And Stephanie, you know, we're 3 different academic institutions here, BI, Brigham, and NGH. Often there's a perception that there's competition amongst the hospitals and the residency programs. Can you share your thoughts on the relationship between the teaching hospitals, and is it a cordial relationship?
I think it is. You know, we share the students. We frequently, our residents match and fellowships at all of the hospitals. The program directors, John, Tara, and I, now me, it used to be Doug prior to me, you know, collaborate with each other. We meet, we think about our training programs. We share education opportunities. Our residents do research at any of the hospitals. There's faculty that do very specific things at each of them. And so really to, I think, take advantage of the benefits of each of them for our residents, for our students, we have to be collaborative. And the hospitals are different. We do different things. Our strengths are different in some areas, and overlap in others. And so I think it's a really unique opportunity for students and definitely for our trainees to be involved in a system like this. And so it's definitely cordial. Not to say that we, on any application day, that aren't interviewing similar people, but that's because, you know, we're interested in similar types of applicants. We like leaders, we like people who are committed to academics, we like you know, empathetic and good human beings. And so I think that, you know, is a commonality amongst all of our programs, which is wonderful. So there are a lot of opportunities for applicants in this area for great programs.
Thank you. And John, quick question. Where do your residents go after they finish residency? And do some of your residents go on to do general surgery or practice in the community?
About 90% of the residents go on to do fellowship training. And frankly, even those who want to go into private practice typically will do a fellowship first, because it's really become the way of the world. We did a recent survey of our graduates, and I think the number was that 75% were in academic practice. 25% were either in full-on private practice or sort of a hybrid. So though many are in academic surgery, actually some are in the community, some are in rural parts of the country. Not nearly as many as I think are in big cities, but it is a pretty diverse group of folks. And the thing I'm most proud of is that when I kind of query those people who are in the community, they're not just doing small cases. They feel very confident doing Whipple procedures and major oncologic surgery, et cetera. You know, despite not having done maybe an oncology fellowship. And I think it speaks to the power of the training and hopefully the fact that we've equipped them, you know, to take on some of the more challenging cases out in the community.
Awesome. And Stephanie, a question that was from the audience. Can you talk about how to navigate potentially applying to both category and preliminary spots at the same institution? Is that something that's viewed negatively if a student were to do so?
I don't think it's viewed negatively. I guess it would depend on, you know, what their reasoning would be behind something like that. I guess my sense is, when I think about the question initially, is I would always want you to get a categorical spot. It's just so much easier. And so then thinking about why you would do a prelim is if you're worried you're not going to get the categorical spot. I think you know, we usually do our categorical spots first and our prelim interviews second. And so might not even know that you were doing the prelim initially as well. And so I think, you know, these are all conversations you can have when you come through, and let us know where you're thinking and why, and, you know, certainly talk about all those things. So I don't think it would be viewed negatively unless there was something behind it. But if you're not sure what you want to do or which track you want to go into, I think that could be a little trickier if you're not really wanting to be a general surgeon and you're going to do prelim because you really want to match into something else. That might be where it would be harder, I think, to come through as an applicant.
Awesome. And one other question that popped in the chat, Dr. Parsons, talk about specialty tracks that may be available in the residency program. Is that an option at Beth Israel? Yeah,
we have a vascular, basically specialized program. I believe it's a 4+2, but you know, that's available. We don't offer cardiothoracic surgery. That may be offered elsewhere in town. And there is a combined plastics residency that's a direct program as well that's available. So we see those residents, but I believe it's based at one of the other hospitals in town, but I see them on rotations and our residents rotate there as well. So there is that opportunity. It's a different process and a sort of a separate application pool that you go through for that.
Perfect. All right, well, we are at the end of our time for this webinar, so I wanted to say thank you to Dr. Parsons, Dr. Mullen, and Dr. Nitzschke for joining us. Thank you for sharing your insight into your residency programs and taking out time during your busy day. I will say a couple closing remarks. One, there's a poll that should be popping up on your screen. Feel free to click through that. What you also see on the screen are some Twitter handles of some individuals that you can follow as you want to learn more about the Visiting Clerkship program or what we have to offer in the Office for Diversity, Inclusion, and Community Partnership. We also have a number of other webinars that are coming forward. Part of the Visiting Clerkship series, we'll have a presentation on emergency medicine in June, and as well as psychiatry at the end of the month. We're going to take a break during the month of July, but pick it back up with a couple other subspecialties, including OB and anesthesia and some surgical subspecialties in August. The recording for the webinar will be available hopefully soon if you want to go back and get some more information or hear what our program directors had to say throughout the day. And with that, thank you again to our program directors for joining us, and to all of the participants. Hopefully we're able to answer your questions, and everyone have a good day. Thank you for your time.